Hi, so today is April 3rd, 2010, and it is 5 days after, my surgery post-op. So I had an underbite, so they went in, and cut my jaw on both sides, moved it backwards, and then, screwed it back in place. But, I had a couple complications with mine. And since I was rotated to the left, there was not enough bone-to-bone contact, so it ended up having to be wired shut. I had the procedure done at South Sound Oral Surgery with Dr. Weber, and he was great. It was all good.
It was March 30th.
On March 30th, 2010.
Mm-hmm.
So just a little bit about me right now. Obviously, I'm still swollen in the cheeks and the here. From about right here to here, I can't feel anything. My upper lip I can feel, but my lower lip, no. I can feel here, but not here. Hopefully that'll go away soon, because it's kind of a nuisance not to be able to feel that. And as far as pain goes, I hardly feel any pain. When I do, it's not more pain, it's just kind of like a throbbing feeling back in here and back in here. So for medication, I'm taking antibiotics, and I'm taking oxycodone, and this goes with it to help with nausea, and some ibuprofen, and they're all liquid. I've just been using syringes to get that in, and it works pretty well. I just put it in front of my teeth, and it goes right through. Doesn't taste the best, but that's okay. For the first couple of days, I didn't really eat anything. I just was still recovering and sleeping most of the time. But I figured out that the best way to eat, they told me I could use a straw or use these tubes. But for me, the best way was just to, I'll just do it with water just to show you. Fill up the liquid in the syringe, and then just push it right into my teeth. And it finds a way through the cracks in my teeth. It's a little bit harder when you get in with thicker foods, but works for me. And as far as food goes, I tried a couple of different things. They recommended Ensure, and I'm sure it's great for you, but it doesn't taste the best. So I've been having a little bit of it, but it's kind of hard to get down. It doesn't taste very good. So I got this Carnation Instant Breakfast, and I blended it with ice cream, and it tasted amazing. It was just like a chocolate milkshake. So I'll probably be eating a lot of those. And then I got some cream of chicken, which I really like anyway, and just added some water and put it in a blender just to make sure it was all thinned out, and ate it that way. And I did the same thing with top ramen and chicken noodle soup. Just blended it long enough to make it smooth enough to fit in between my teeth, and that's been fine. So I'm gonna have to be wired shut for about another week or two, and then I'm gonna have rubber bands holding me shut. So I don't know how well the food will taste in 2 weeks, but we'll see. And then for swelling and pain, this thing is really great. They gave it to me. It's just kind of a strap thing, and you have a little plastic device that you just shove in here, and then it just velcros right onto your head, just like this. And you might look kind of stupid, but it feels good, and so when I take a nap or go to sleep, I'll put it on, and it feels good. The pressure feels nice to keep everything together. Yeah, I've been drinking a lot of vitamin water to stay hydrated, and that's pretty much it.
Oh, can I ask a question?
Yeah.
Is it worth to go through all this trouble?
Oh, good question. Well, I can't really tell what the final result is because there's just so much swelling, and so, but it feels pretty good. Everything feels like it's touching and good back there, and there honestly hasn't been enough pain to say it's not worth it. It's just kind of the discomfort, and the liquid diet is really the only bad. But I got to miss a week of school, so.
So how do you feel about your mouth wired shut, and trying to get food inside and everything? Is that challenging or?
Well, at first, I mean, I was so knocked out when they first told me that I didn't really think much of it, and it feels weird, like just to not be able to open your teeth, but you just get used to it, I guess. And eating and breathing hasn't really been an issue, so I wouldn't freak out if it happened to you.
It has been already 5 days, so you think you are willing to wait for like 20 more days or something?
I guess I'm gonna have to. Yeah. I'm hoping that when the swelling goes down and the numbness goes away, that it'll be a lot easier to just maneuver inside my mouth and to utilize my mouth a bit more.
So can you tell me a little bit about the hygiene, because your mouth is shut, and how you clean your mouth?
Yeah, so right now, actually, there's kind of an awful taste in my mouth. It's like kind of in the morning when you haven't brushed your teeth yet. And there's kind of, they told me that it's not going to go away. So you can just gargle with salt water to get the bacteria, and just gargle with water. But they told me not to gargle with Listerine or anything because the alcohol is not good on the incision points in the healing process. But I think later on I'll be able to use that. And then I got a baby toothbrush, has a little M on it, it's cute. And just turn away toothpaste, and I just get the front of my teeth and not behind. And they said to work on the gums because you don't want your gums to get swollen, or but it's hard because I can't feel my bottom teeth at all, so it's really hard to brush down there. But
Malik, I think you covered everything, but there is one thing that's very important that you never mentioned. That's the scissor.
oh,
Can you show it? That's all the time with you in case.
So I guess they handed these to my parents and said, "Here you go. Always have this with you at all times, no matter what, because if something happens, you're gonna be able to cut your wires."
So you need to carry it with all the time with you in case of emergency, like you cut it and.
Yeah. Okay. Bye.
Bye.